and in succession to the videos what I have been taking up in microbiology. So today's video I'll be mainly discussing about the clinical features what are associated with the hepatitis B virus infection. So students and viewers, starting with the clinical features, this becomes a very important question in the professional exams where you are supposed to write about the clinical features what are associated to the hepatitis B virus. So I have summarized it in a very short way as to how we can very easily remember and pen down in sequence the clinical features of hepatitis B virus. So starting with, so first it is the incubation period. So when we look at what is the meaning of the incubation period? So incubation period is that period since once the virus is going to gain access into the body, and the time elapsed between when the virus gains access into the body to the time when the first signs and symptom of the viral infection shows. So in the incubation period of hepatitis B virus is long, about 2 to 6 months. So students and viewers do remember that when we look at the incubation period is that period, the time elapsed between the actual entry of the virus into the body to the appearance of signs and symptoms. So that period is called the incubation period, and for hepatitis B virus it is 2 to 6 months. Now when we look at the disease, so how is the disease? So disease, when we look at the hepatitis B virus disease, it is severe and it is protracted, means the condition is very complicated. It's a very severe infection and it stretches to a very long period of time. The onset is insidious. So the literal meaning of the word insidious is that when hepatitis B virus infection is going to take place, what happens is it is a very slow progressing, the infection is very slow progressing, and but the damage what is incurred, it is having a very long course duration. So the onset is very insidious, means the symptoms what are going to appear, the symptoms of the infection what are going to appear, they are going to proceed in a very slow and a gradual pace, but the effects what are produced by it, it is a very long lasting. The long lasting and very harmful deleterious effects are seen. So such a condition, it is called as insidious, and the condition of fever is not prominent. So students and viewers do remember, in hepatitis B virus, the fever what is there in most of the viral conditions, there might be a possibility that fever can happen, but in case of hepatitis B virus, fever is not prominent. Now when we look at the extrahepatic complications, so there are certain other complications that are associated to hepatitis B virus. So the extrahepatic complications include the urticaria, means there can be itching, there can be hives on the skin. So urticaria, arthralgia, means there can be joint pain, polyarteritis nodosa. So polyarteritis nodosa, the word itself is suggesting that the arteries which are having small and medium sized arteries, the inflammation of the small and medium sized arteries is going to take place, as well as nodosa, means there is swelling of those arteries. So polyarteritis nodosa, in the condition of hepatitis B virus, this polyarteritis nodosa can be seen, that is in the small and the medium sized blood vessels. The vasculitis, that is the inflammation of the blood vessels of the small and medium sized, is going to occur, and there is a nodular enlargement, there is swelling in these arteries that can be seen. Apart from this, there can be glomerulonephritis. So glomerulonephritis is a condition where the glomerulus of the kidney is going to get inflamed. So there is inflammation of the glomerulus of the kidney. So this glomerulonephritis may occur due to the antigen antibody reaction circulating and the circulating immune complexes. So whenever any virus is going to gain access into the body, what happens is that the virus, the antigen is the virus, and the antibodies what are produced in response to that viral infection, these antigen and antibody are going to form certain complexes. So this is the antigen antibody reaction is going to form certain complexes, and these complexes are referred to as the immune complexes. So circulating immune complexes are there containing the viral surface antigen. So the virus, the hepatitis B virus, what the surface antigen, what it is having is, so these immune complexes are formed due to the antigen antibody reaction, and these circulating immune complexes, they are ultimately going to cause the glomerulonephritis that is affecting the kidney. Now moving on to the next important clinical feature, that most importantly, very important, that about 90% of the adults with acute hepatitis B infection recover within first 1 to 2 months of onset. So most of the patients of hepatitis B, if they are diagnosed, so most of the patients, the 90% of the adults, it has been found that the acute hepatitis B infection, if it is of a recent or a short-term infection is there, so acute hepatitis B infection, the individuals, the adults, they recover within 1 to 2 months of the onset, and within about a period of 6 months, the virus, they eliminate the virus from the body. So most of the adults who are having the acute hepatitis B virus infection, they are going to recover within a period of 1 to 2 months of onset, and within a period of 6 months, they eliminate the virus from the body. And the last, not the least clinical feature, that the some patients of this hepatitis B virus infection, they progress to the chronic active hepatitis, and once they progress to the chronic active hepatitis, that can ultimately going to, since it is hepatitis, means inflammation of the liver is there, so ultimately this chronic hepatitis, chronic active hepatitis is going to progress into cirrhosis. Now in cirrhosis, what is going to happen is that the lung, that is the liver cells, that is the liver parenchymal cells, they are going to form, they are going to get forms fibroid tissue, or there occurs scarring in the liver parenchymal cells. So this hepatitis, once it is affecting the liver, and once the scarring and the fibrosis of the liver is going to take place, so such a condition, it is called as cirrhosis. And later on, in later stages, if it is left untreated, so late consequences can be of chronic active hepatitis is that the primary hepatocellular carcinoma can be seen. So in later stages, this can even progress to cancer, which is called as the primary hepatocellular carcinoma. So students and viewers, this was a very short discussion where I have discussed in simple language. In professional exams, you are supposed to write about the clinical features of hepatitis B virus. Students and viewers, if you like this video, give this video a thumbs up. If there are any queries or comments, you are most welcome to comment me in the comment section. And students who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.